Sepsis is a disease that occurs after an infection. And it occurs when that infection gets so bad that you have organ failure. And that organ failure can be seen as things like needing to be on a ventilator because your lungs aren't working well, needing dialysis because your kidneys aren't working well, or needing some medication to keep your blood pressure up because your heart just isn't pumping hard enough or there's not enough vascular tone. The reason why sepsis is important is because it affects many people worldwide. In the United States alone, there's about 270,000 deaths each year from sepsis. And it's actually one of the biggest healthcare expenditures in the hospital, with billions and billions spent on sepsis care. In addition, all those numbers happened before the COVID pandemic. What I can tell you is that when people have very severe COVID, they actually end up with sepsis as well. People in the ICU with COVID have organ failure, they have to be on a ventilator, they need dialysis, and this is all the result of sepsis. One thing to keep in mind too is that sepsis is a disease that can usually be treated very well. Time is important. If you can get antibiotics early on or get control of that infection early on, potentially through surgery, you can have a very good outcome. And it's important for people to look for signs of sepsis. And the first sign is just a fever, a temperature. Another sign is just feeling very sick. And this is kind of a different kind of feeling sick. It's not you have a cold, you feel a little bit out of it sick, but a kind of sick where your mental status is a little off. You might be a little confused. And also one where you have a lot of trouble breathing. Those are the signs to really look for sepsis. And definitely, if you feel like you have that, go to the hospital to get treatment as soon as possible.